Good evening and welcome to our series, Get the Facts. I'm your host, William Neal. This evening, we'll be looking at Get the Facts about getting vaxxed. But before we do that, we want to give you an idea of what are our COVID numbers over the last week, from last Monday to today. So, this week, in terms of our COVID numbers, we have first, total tests reported 7,523. Total positive cases reported 275. Total deaths 3. Now, in terms of our vaccination data, total vaccinated for the week 16,108. Total single vaccinated or receiving their first jab for the week, 10,646. Totally fully vaccinated for the week, 5,462. Cumulative data, total vaccinated, 139,413. Total fully vaccinated, 55,143. Of course, those numbers are encouraging, but we want to definitely get to where we have the numbers that are totally vaccinated are more than 100,000 or 200,000 or as close as possible. And we're moving into our first segment for tonight, and I have with me Dr. Cuellar. Good evening and welcome to the show.
Thanks for having me, William.
Now, Dr. Fernando, you're an internist, which means that you specialize in taking care of the entire adult
right.
Population and what's inside.
Right.
Now, let's talk a little bit about vaccinations and why or how it was developed. First of all, let's start there, because I think that's an important thing. People have quite a number of questions and they talk about the pace
right.
at which it was developed.
Right.
So let's talk about that. Is that a real consideration?
I think you've actually hit the nail on the head, William, when you put forward that question as first, because that has been the most frequently asked question, that has been the biggest concern about the vaccine for COVID. No? How come, why was it developed so fast? And there's a scientific, really good answer for that, because I had those answers too. We've been with this 18, 19 months now. From March, the whole 2020 was fighting the disease and learning more about disease, learning how to treat it. And towards the end of the year, early this year, we started hearing that indeed a vaccine is upcoming. So to answer that is that we have not been a stranger to this virus. We knew the grandparents of the virus, the SARS, that was the turn of the century, around 2000. We knew the parents of this current virus, which is the MERS, so we were exposed to this virus in its older generations. No? So although we call it a novel, it wasn't so novel after all, because we have been exposed to it, so we knew about it long time. And then, from then, it's not just studying the virus, but already started making plans to develop a vaccine against the virus. So when it was, the button was pushed, okay, we want to do the vaccine, everybody got together, okay. The vaccine technology nowadays, it's just like the phones. You could remember when me and you
the house phone.
We made a blackout.
Or the big phone.
We used to call it phone booth.
Yep.
Yeah, we walk on with these big phones, and now we have phones that can do so much things. The same thing with vaccines. Vaccine technology has gone leaps and bounds compared to 10, 20 years ago. And the way I answer this, I like to say, is that vaccine technology is at the point where the foundation is like building a house. The foundation is there. The walls are put up already. The doors are put up already. It's just to have put on the roof. And that was done within the past 6, 8, 10 months. Now you put on the roof, the vaccine, completed the vaccine, then they tested the vaccine, okay? thank God they never come and ask Belizean for test vaccine by there as such, to include them in the famous experiments or trials. I don't think our culture affords us to do medical experiments in Belize, no? Okay? And everything in medicine is tested and experimented on. Tylenol was tested, penicillin, all in latest chemotherapy drugs and cancer drugs and HIV drugs have been tested and experimented on, no? So they did the trials for this vaccine. They did the 3 phases that we usually use. It was done indeed at a quicker space, that they didn't do it one after the next. They did the 3 of them together, and that's what made it so rapidly, quote unquote, developed. Another thing which was very important, the pharmaceutical companies came together. They're not a fight this time. They're not a fight for see who will come out first. They realized this is a global issue. We need to work together. They did that. They work along with countries and states and so forth, individual organizations like the Bill Gates, and they all put their resources together. And that would be the answer why this vaccine was brought on ahead of time. Now, one of the biggest regulatory bodies that we use, especially this side of the world, is the FDA. That's one of the biggest licensing regulatory bodies. Say, okay, this good, this no good, okay? So what they did is, okay, we need to hurriedly authorize it. That's why the term emergency authorization came about. They say, okay, the data that you're showing me show that it's safe, it's effective, we're going to give you an emergency. We need more data down the road, and we are gathering that. And lo and behold, now in August, we are already hearing that full authorization might come as soon as the end of the month or early next month. So that is, I say that because that is one of the reasons why people would be hesitant, reluctant, because you see, it's just emergency authorization, and that's why they still dare call it experimental drug.
Now, just to push the conversation forward, you know, you have people who are hesitant, and a part of it is they cite that the CDC seems to be changing its mind.
Right.
And so if they're not certain and they're the professionals, why should I participate in this, you know, experiment against my will?
Yeah, that's a good thing. And I think the messaging was perhaps not the best, because what we could have said is that what I say today, the 9th of August, might change next week. It's fluid, the famous word fluid, because the data comes in, we have surges, we change things, so the goalposts are changed. Expect that. Don't expect what I say in August 2021 will hold out until December 2020. It may change. So I'm telling you ahead of time, don't hold me to where Fauci say back in January. I say, you see, the man may say, no, use mask. Then they say, use mask. Then everybody looks so confused. But we just have to react based on the reality of the time, no? Okay? Now, I do want to point, and I think this is important. We should not equate anti-vaxxers with hesitancy.
Okay.
It's important to make that differentiation.
And I was going to get to that question, because you have, Belize has a history of being open to vaccines. Most of us are vaccinated. As a matter of fact, even I can recall when I was going to study in the US, they had a list of requirements that you have to fulfill in terms of medical requirements for you to enroll in college.
Correct.
You know, including at the time, I think there was hepatitis.
Right. Meningococcal. Yeah, those are the two, and you're right. I mean, so and it's important to say that because we Belizeans, Belize country, have bragging rights when it comes to what percentage of coverage we have with vaccines, especially childhood diseases, tuberculosis, polio, measles, mumps, rubella. Those are things we could brag amongst the whole of Latin America and Caribbean. For say we did at the top 5 perhaps. We did above 95%. So those we are generally have accepted vaccines all along. So we don't know an anti-vaxxer community or country, okay? And the later vaccines, the meningococcal, the hepatitis, the HPV, the shingles, all of these things, we accept it, and especially those who are going away to study, who travel. You have certain parts of the country that you have to have requirements, yellow fever, for example, in South America, Guyana, that kind of thing. Those people go and get their vaccines quite readily. So we would not want to call, I think that then the borrow name will not belong today. We are not anti-vaxxers. We should be hesitants, or I don't know what that word, they known for it, hesitors. But we should be, because it's our right, and we should ask questions. I had to go and convince myself, research, hey, how come this thing come out so fast? Is it safe? We look at the data, we ask people, everybody connected around the world with phone and with Kindle and computer, so I could ask colleagues in Italy and Spain and Guatemala and Mexico and states, hey, where they go on? Then kind of thing, no? So we had the obligation almost to be asking questions about the vaccine. Then you satisfy yourself by asking the correct questions and get the information. Because I think the biggest enemy of the vaccine is disinformation. Is what you get off your Facebook and TikTok, and where the lady in the bathroom, they post on your Facebook, and this one had that one.
The source, right?
The source, yeah.
Now, the other question I want to ask, because as we're talking about people and their rights and to decide whether, you know, they can delay or hesitate when it comes to taking the vaccine, what is the threat to the wider society if I, as an individual, decide that I'm going to opt out at this particular phase and it continues to be low? Right. Why is it so important that we not only do it, but do it quickly? Right,
right. Good question, William. Number one, it's a risk to yourself, okay, by not getting vaccine. The vaccine has shown, and especially now in August, is showing that people who are hospitalized and dying are the unvaccinated. There's no question about that data. Everywhere you see it in the States, in Belize also, we are seeing that people who are seriously ill are those who have not become unvaccinated. Mind you, the vaccine not stop you from getting the virus. So that's a no-brainer. That's no question we need for quarrel about. You get the vaccine, okay, and you could still catch the virus. You could still get sick, but you're not supposed to get seriously ill, or your risk of dying is very, very minimum, okay? So that needs to be established. And the other thing is that it has shown also to reduce the viral load, meaning the amount of virus you keep in your body, and therefore it will lessen the spread and lessen the chance, and this is important, lessen the chance of mutations. Because the more you got in the community, the more chance of mutation. So I think that those who are against vaccine should thank God that we never have this choice when we're against polio and TB, because then we may still say polio and TB. But we should thank those who have received those vaccines for not have polio and TB.
Now, what would you say to someone who approaches you? Because I think a part of it is you need a robust conversation. You can't be dismissive, right, or disrespectful to people, correct, who, you know, share a different opinion at this point. Right. But what would you say to someone who is still hesitant to take the vaccine?
Well, I will tell them first it's their right. It's almost obligatory for them to be asking questions. No, make nobody put nothing in their ear without ask the proper question. So you ask that question, you seek information, you have that discussion, you go to your provider, nurse, doctor, so forth, have this type of discussion. Is this safe? Why is it safe? What will happen to me? When might not happen to me? My condition that you know it as, would I be able to tolerate it? I had a history of blood clot last 6 months, would I be able to take it? I had a history of blood clot 6 years ago, would I be able to take it? That type of discussion you need to have with your doctor or your nurse or your caregiver, okay? So I would answer them like that. Have that discussion, research, and indeed, not go tell the people how nothing will happen to you, okay? There's a risk that you will catch flu-like symptoms. I've had to hospitalize people because of reactions to vaccine, but thank God, you know, they get better. So you do expect them to do better, but don't go tell them it's that your ideas are crazy and you're crazy because you don't want the vaccine.
Now, one of the other questions I want to ask you, since I have you here, is the whole thought that some people say, well, I take good care of myself. I eat healthy. I avoid certain situations. I make good, you know. So therefore, I don't have to worry about this.
No. It's all for anything in life, anything. It's always good to be healthy, have the best immune system. I would dare tell people that one good immune system by lessening chance of getting certain types of cancer. Okay, because when we talk more about cancer now, and thanks to science and scientists, we realize though that the whole thing with cancer might have one spin-off of our immune system. So having a healthy immune system is always good, but the information that we've seen over the past 18 months, healthy people, young healthy people have contracted COVID and had seriously illness. They end up in the ICU, they end up with lung damage, then die. So not because you're healthy that our absolute prescription that you know get terribly sick or die from it.
Now, okay. Dr. Quer, we'll just shift, and because this is an interactive show, and we encourage you to send in your questions, we do have a question by video that we'd like to play for you to respond to.
How many people have died after taking the COVID-19 vaccine?
No absolute link to the COVID vaccine and death. In Belize, and I don't have all of the data throughout the world, but in Belize, nobody has died after taking the vaccine.
How many people have died from not taking
300, 300 and whether 339 now?
Yeah.
Or 342 now.
You know, while I was getting dressed, I saw that there was a memorial for Mr. Romero, and it has been a year. And I think for a lot of people, even though on the first show that we had 2 weeks ago, you have people giving testimonials about the loss that they have experienced. You know, there's a gap. We see the statistics, and very often you don't personalize or humanize it. Today, when I was getting ready, I saw the, you know, the memorial for him, and it's been a year. But you know, the family.
He's the first one that passed away.
He was from Corozal. You remember the one with the Belize flag and everything?
Yes,
Mr. Romero.
Right.
Senior.
Yes.
No, but why I'm raising that question is because people see statistics, but you as a doctor, you come face to face with those statistics as well. But on a very personal level, when you see someone struggling with the disease itself,
right.
How does that change your perspective in terms of when you see a death
right.
being reported, and we've had 3 over the last week?
Right. Particularly COVID, it's really terrifying, okay? And I don't know a drama queen, okay? I calm, collected, and rough, because that's my training. My brain is wired to be calm all the time. But this particular disease, unlike one gunshot to your head and stab up your belly and take out guts to come out and foot the rotten off, okay? This particular thing, when it comes to not be able to breathe, and we like to call amongst our colleagues, we say, the one that is suck here. Right, then I get big, then he, please help me. And what was very, I don't know, confusing perhaps at the word, just like I said, things change. At the beginning, we were taught, okay, when they come like this, we're hurrying to intubate them. You ready? 3 months after, no make we hurry intubate them, make we wait a while, make them suck here some more, make we do other thing, and then we intubate them, okay? But that sucking a year, that hunger for a year, that can't breathe, that was not a nice way for them.
It's like a near drowning experience that you're not going to get out of, right?
Please. And that's so, it's good for make people who are skeptical come around to the ICU, we dress them up and tell them, start up here 2 hours and watch this man dead. And you say, or this lady dead, and you say how it happened, okay? It's not a scare tactic, but it's reality. And I'm doing that to answer the question as a physician who have seen many of these. It's not one of the nicest way to die. And over the past 30 years, I have faced death thousands of times, no? Okay, but this particular 18 months has been very, very frightening.
Okay, let's shift our focus again, and we have now another question that was by video.
Why should I take the vaccine if I can still contract COVID after doing so?
Taking the vaccine is to prevent serious sickness and death. Okay, having the vaccine lessen the chances, and the data is more and more showing that you know, end up in an ICU, and you know, the likelihood that you die from COVID is much less. You know, I stop you from catch the virus. You are still catch the virus, okay, but you're not supposed to get that ill, no? And I think we are seeing other variants coming up, which is more frightening, more serious. We talk about Delta right now, we're more West Delta Plus, and basically they're more stickier, so they stick to the surfaces easier, and you need less viruses. Then we have Lambda down the road, we're done the show that it might be more deadly. So the vaccine will help for lessen the chance that the virus keeps mutating.
The question that begs asking right there is, you're talking about the variants and they're coming and they're more aggressive, etc. And we're talking about the numbers of people, talking about herd immunity and all of that.
Right.
Why are all those things interconnected? And you know, you're looking at the societal response as a whole,
right,
not as individuals.
Okay. One of the things we had option as humans and the world and countries and people is not to do anything. Cross our hand, and who dead, dead. Let the fittest of the fittest survive. But if we look at the last pandemic that we come closest to, which is the Spanish flu, 50 million people died. 50 million people died worldwide, and the population then was only 1.5 billion. We don't triple that for that. So if we do the numbers, 200 million people were dead. Are we willing to just close it? And that I estimate it could be much more. And if we do our numbers in Belize, if we never, government never decide, but we need money for buy vaccine. We don't want to take no vaccine for nobody. Just who get it, get it. You in your family say, okay, out of 4 away there in here, 1 away, 1 dead. Okay, then numbers where we see like 340, no 341. I sure they in the thousands. Okay, we're a small country, small community, and we know, we must know somebody, either for your house, for your lane, for your town, your village where died from COVID, and you can say much more than that. If that are the type of human and people where we want, well, that's how we can get herd immunity by not doing it. We still want to get herd immunity because the virus will circle in the population, and at some point 70% will get infected and develop immunity.
The other question that I have before we bring our segment to a close is, you know, we've seen these hot spots, right? And we see the decision led by the Ministry of Health to close certain areas, right? Why is that such an important thing to, one, identify your hotspots,
right,
and two, to ensure that they are quarantined to a certain extent?
I think a very common sense answer to that. That just was a simple, basic public health standard, using the mask. Say, okay, who am I there in touch with you, the contact tracing. Once we identify that the village or town or so have more numbers, we call it a hotspot, so we enclose it so that it not spread to other people, okay? I hope you didn't ask me, well, why certain communities were treated different from others, which we can't answer right now, no?
No. And the final question I have is with regards to, you know, we've heard that the Delta variant is easy to spread as chicken pox. Now, why use that analogy?
Because chicken pox are a very transmissible disease. I mean, it's still around. You have an office with 6 people, and if one go in there, definitely 3 of them will catch the chicken pox. Right? It don't need much interaction. So that's one of the closest diseases that come close to the Delta virus when it comes to the transmissibility. It's easier for catch. And the reason is that the virus has changed to the fact that it gets stickier. Okay, remember virus, one of virus' sole objective in their life is to continue being alive and replicate.
To survive.
To survive. So they want to change any which way for do that. And this time that, okay?
Now, we have another question for you, and this time it's taken from Facebook. And it's Sheridan Lemott. Why only when the entire country is getting vaccinated the numbers are surging? What about the new Lambda variant reported to be resistant to the vaccine?
Yeah. The Lambda variant is one of the new variant that is being identified in the South America area. And it's alarming because it's indeed showing a little bit more resistance to the current vaccines. And that is true. And we just had a discussion today that we have to prepare for Lambda, okay? And we have to prepare with good public health measures. That are the best defense, okay? Actually, if I have one few seconds.
You can go ahead, yeah.
The technology in vaccines are now ramping up the studies to stop the transmission, okay? They realize that just by preventing serious illness and disease, they're not enough. So then they try to tweak it some more so that they stop the transmission, which, thank God, would be another tool in the toolbox as such. No?
All right. Well, thank you very much for this first segment. And we'd like to ask you to stay with us a little bit more. We have another discussion.
Supper will be provided, I hope.
Of course.
Of course. Okay.
Marlene? We're going to go ahead and take our first break. And when we come back, we're going to be looking at the psychology behind vaccine hesitancy. Don't go anywhere. Get the Facts continues after these messages.
Why should you wear your mask? To protect myself. My friends. My family and others. I wear my mask because I love my grandparents. With so many reasons to wear a mask, we continue to advise persons to wear a face mask properly, covering both nose and mouth. Together, we can keep Belize COVID-19 safe.
Save the credit union way.
Member owners are encouraged to save regularly, borrow wisely, and repay promptly.
No use keeping the money in your pocket. Soon as you turn wrong, you know you ain't got it. So as money goes from hand to hand, give your cash to the umbrella man. I telling you, save the credit union way. Save, it will make you rich someday.
As police officers, we are expected to continue to carry out our duties, trying our best to uphold and also to enforce the health regulations. The police department has an important role in the overall fight against this pandemic. We have been affected greatly as frontline workers, but now we have a vaccine to help us move forward as a country. I believe in the COVID-19 vaccine. I will take the vaccine when it's my turn. I urge you to take it too. #GetVaccinated_Belize.
It is my time
to protect your life.
Don't wait to vaccinate.
I believe in the COVID-19 vaccine.
Do not hesitate, Belize. Vaccinate. Be COVID-19 safe.
The vaccine is the best way to protect lives.
Don't wait. Vaccinate.
If you care, love them,
Protect them.
vaccinate them.
And welcome back to Get the Facts. We're moving into our second segment, and in this segment we're going to be looking at the psychology behind vaccine hesitancy. And joining me for this conversation, we have Deshane Gutierrez Lopez, Clinical and Psychological Services. And we also have Sumaya El Amin, a registered nurse. Good evening, ladies.
Hi, good evening.
And welcome to the show.
Thank you.
Now, I want to start off first with Nurse El Amin. Let's talk about the fact that you were hesitant. Even though you're in the medical field, you had some hesitation. Let's talk about that and how you managed to get over that hurdle.
Okay. So for start off, hi, yes, I'm Nurse El Amin. I work at Belize Medical Associate. I wouldn't say I was hesitant or not sure if I wanted to be vaccinated or not. Yes, I wanted to be vaccinated. I've been vaccinated before. All my childhood vaccinated I have received. I was just more weighing on the time and the side effects. I don't relate to the side effects now. You know that blank piece of paper we give you guys when you take the vaccine, okay, you could have headache, you get the tiredness, fever, chills. So I was weighing more to that as if I take the vaccine today and if I'm working tomorrow and I start with fever and chills, will I be able to call in sick from work? Would that be a paid call in sick? As a matter of fact.
So you mean to worry about your cheddar?
Yes. And right now we're back down to worry about cheddar because if you're not get vaccinated, you have to pay if you get swabbed every 2 weeks. So buy along to your cheddar indeed.
Now, you know, because generally my mind is racing. Because one of the things I know that you see, for example, commercials from the States with certain medicines, and then they start telling you everything that it can give to you in terms of the side effects are this, and sometimes you go like, man, I might as well just not take the medicine. But people do anyway. Now, is it in terms of yourself, looking at the symptoms that you spoke about, how did that rank in terms of your decision? How critical were the side effects in terms of your hesitation? Okay, or your delay? I won't call it hesitation, your delay.
Yeah, like you said, lots of medication, it has side effects listed there on it. And I just wanted to ensure that I had time allotted to, if I feel that way, time to rest and as it passed. And as I took my vaccine, I had those symptoms, yes, that they showed on the paper there that they gave you.
Did it affect your cheddar?
It didn't affect my cheddar, no. Because I ended up having the time, getting the day off from work, and it didn't interrupt anything. I got my symptoms passing, you know, I get the symptoms, it passed, and I'm over it, ready to take the next shot.
Now, so you're fully vaccinated?
Yes.
Now, let me go to Deshane. As someone who looks at the psychology of things, how do you introduce this entire idea, you know, of the vaccine hesitancy? And how do you approach a conversation with someone who is at that point?
So I'm glad that nurse was able to talk about her factors that made her contemplate on when she will take the vaccine, because that is important. We don't do things in a bubble. We have to look at all different factors. So for each person, when they're contemplating, they have to look at their whole wheel, their social, their financial, their occupation, all of that has to be factored in. Now, we've been in this pandemic for a year and a half. So we have a collective trauma. Compared to previous pandemics, technology wasn't a thing. So we didn't hear all the news, we weren't getting all the stories, all the feedback and all that. So we have a worldwide trauma. And then we have to think about what's happening in Belize. How has this pandemic affected our household, our day-to-day routines? So that collective trauma impacts how we make decisions. So when we think about making decisions, we have to consider what is happening with us and how that is affecting us. Whenever we experience trauma, how our brain processes information is different. And so the first set of when we did the rollout for the vaccines, those who were willing initially took it without much probing needed. Now that we are in this stage, the message that is being across has to factor in where the different clusters of groups are. How did the pandemic affect them? Because now we have to look at the change process, understanding how trauma, change, and the vaccine come to play. Because it's not about hesitation to just take the vaccine. Like Nurse said, she had to factor in day off, how that will affect finances and all that. So we have to look at each cluster's wheel. And so in terms of moving forward, is that information, how many clusters we have, what type, and to be able to provide information based on where they are.
Now, some people tend to be very dismissive of people and their concerns. How do you get that kind of discussion with people without it being confrontational? Because many times we're not looking at it in a logical way. It's an emotional response, and people get stuck there, you know, in terms of, you know, I have to be right, or, you know, I feel this way and I have the right to feel this way. But how do you get them from having just an emotional response to looking at your cluster, your wheel?
So each person and their group have different social experiences, life experiences. So for example, we all say that we are all experiencing this pandemic together, but we're all also experiencing it differently. And so how we experience it, how our group experience it may be different from our next group. So that has to play a role in terms of how we target. Now, people being aggressive to the conversation, that's also a trauma response. We have 4 main types of way how we respond to trauma. We freeze, we fight, we flee, and then we fawn. And so that is the same thing that is happening here. Some people will fight you. Some people will just not say anything. They won't do anything. They won't move because how it's impacting them, their mode of responding. Some people will automatically, fine, you give the information and go along with it. So understanding that when we have that aggressive person, it's not because they naturally want to be aggressive, they're defending themselves. Similar to when Doc was talking about survival mode, that's their survival response. So we have to be able to cater information based on how people may respond from a survival perspective.
And social media, you spoke a little bit about that in your initial response. You know, there's the thing about, we're talking about a virus, but we know also that things can go viral on social media, and especially when they may be negative, you know, because positive things in life are very hard to go viral, but the negatives seem to amplify very easily. So how do you manage that, or how do you encourage people to, again, look at that in a critical way and make a decision despite all the fracas and the, you know, everything else that may be on social media?
So that's also a survival tactic that we all experience. So for example, the reason why we are more prone to negative information is because the body wants to survive. Humans want to survive. And so to be able to survive means you have to be able to detect negative information much faster. So that's the reason why we'll listen to negative information first, because we want to be able to say, how can we be prepared? So understanding that it's a natural, that negative things will go viral faster, it's also helping us to plan now, how can we counter that? Because that's a natural response. We're looking for the negative things because we want to know, if this really makes sense, what do I need to protect myself? So when we want to be able to create change because a person has gravitated towards the negative information, we want to be able to say, okay, this person is in survival mode, the negative things is going to be the first thing, so how can we help them to challenge that? But they have to also feel safe, trust the process. So who is giving the information, where is the information coming from, and what in their environment is letting them feel safe with this particular source compared to another source. So for example, when I decided to take the vaccine, I went to my alma mater to get information, which is the University of the West Indies. They had a talk, and because I trust that source, I was much willing to be able to get the vaccine because I went to a source that I trust. So again, we have to be able to figure out, okay, where are the clusters of information coming from? Now, it's really hard because of Facebook and the World Wide Web, but we want to be able to target. And once we understand our population, so we have the numbers in terms of how many people have been vaccinated. But we also need to be able to get what are the communities and what's happening in that communities and what are the factors, what are the jobs, what are the societal norms in that community. That will give us a better insight apart from just raw numbers, because that's still not going to help for those people that need that extra. We have to be able to speak to them.
Now, we have another video question, and so we can have that question now.
How can I separate and ignore what are rumors that are causing me to be hesitant?
So how do you ignore? So you want to be able to process what's happening with the information that you're getting. So it's not a matter of always ignoring, because like I said, there's a loop of different information. Do you know the source that you're getting these information from? And then you want to be able to assess your sources and how comfortable you are with your source. So if you're getting a ton of information, okay, which two are you struggling with? And then based on the information that they're giving, you want to assess, okay, can I get other information that will provide me more information as well? Because the more information you have that you trust, we don't make change and we don't have cultural change unless we trust the process. Because we will never always, we can't predict everything in life. But each day we trust that we could fight this, we'll make sense of this. So it's the same way when we have information about the vaccine. Do we trust this? Can we trust that we could trust this process even if we don't know for sure what would happen 10, 50 years from now? And so you have to be able to screen the information that you're getting. And if you're getting so many negative, and like I said, our body is prone to gravitate towards negative stuff because it's a survival tactic. And if you're aware of that, that insight alone will help you, okay, I'm getting a lot of negative information. How can I get some positive so that I can make a balanced decision for myself?
Now, one of the final questions I have for you, and then I also want to talk to Nurse Elamin. When you talk, a lot of people may take the approach that, you know, you just sit around and wait this out and see what happens, right? How do you engage someone who has that attitude that, you know, I'll take all the precautions, I'll do the 3 W's, you know, I'll stay away, you know, when I come home I will go through all the rigors and, you know, and abide by curfew, you know, but I'll just wait it out.
You see, that won't really happen. And someone had asked the question earlier in terms of, well, why are people getting vaccine and why is the number going up? Again, the practices that we do will affect the numbers going up. So some people get comfortable because there are a lot of people that is getting vaccinated, but also some people are saying, well, a lot of people aren't dying, so I'm going to take my chances. I always ask the question, if this was last year when there was a lot of deaths, a lot of unknown, would you have taken the vaccine then? Because the environment will create an impact in terms of what we do and when we do it. So even though now people have had the time to be able to say, well, the vaccine has been created in a short period of time, so I don't want to take it and all these things, it's because now they're in a different state of mind than when the virus first came out and we didn't know much about it to now. So now they are in full survival mode at a different level. So now all of these things have to be processed. And again, like I said, each person has their own wheel in terms of their environment, their finances, their family, their medical history. All of that have to be taken into consideration. So in terms of when people are hesitant and how do you encourage them, you want to be able to look at clusters. And the reason why I'm repeating clusters is because the same way how we have clusters with the rise of the pandemic, we have to understand what's happening in those areas that is promoting an increase of cases in those areas. Is it a particular community? What is happening in this community that is encouraging the spread of the virus? Once we're able to understand that, we're going to have a better way of being able to change what we want. Because what we're out asking for is a whole change in norms, a cultural norm. We have a lifestyle change. We have to take risk in terms of some people may have side effects, some may not. So we have to really understand what's happening in these environments. So we're having an increase in numbers now because the environment has changed.
Now, Nurse L, thank you, Deshaun. You work already in a medical area, so in terms of the protocols, in terms of, safety, washing your hands, etc., that's something that, or wearing a mask, those are things that, how long you've been a nurse?
About 5 years. Yes, those are things that came like second nature to us. I think that was the reason I was still like dragging my feet with the vaccine, because I work along Dr. Cuellar, and we work with COVID patients, and it's been a year, luckily, I should say luckily, that I have not been exposed to getting the COVID-19 virus, no? I have not been swabbed and tested positive for the COVID-19. So that too, alongside with the side effects and the time, had me dragging my feet.
So one of the questions that Deshaun said earlier, a year ago when you saw
if you asked me a year ago, I would have been first in line, I would say. Yes, I would have been first in line.
All right. And with that, what we're going to do is we're going to shift gears just a little, and we have some testimonials via video that we'd like to share with you before we go to our second break.
Have been vaccinated? Yes, I'm fully vaccinated. Yeah. Tell us why do you do that? For my safety and protection, and for my children and my grandchildren and everybody who I come in contact with. That's the reason why I took it. I don't think, I've listened to the experts talking about it, and I think it's the safest thing to do. So I make sure that I'm fully vaccinated.
Would you encourage your colleagues, friends, and other family members to take it?
Definitely, I would. From all the studies from the professionals, I believe that it's best that you take it in order for you to be able to protect yourself and protect your loved ones.
Make no sense at all. No kind of sense. That Belize video when I have that sign up there in China for.
That not in China at all, that in Spanish.
You understand what it said then?
Yeah. It said wear your face mask properly, cover your nose and your mouth.
Will help prevent the spread of COVID to others. Together we could make Belize safe.
Wear your mask properly over your mouth and nose to protect yourself and others. Together we can keep Belize COVID-19 safe.
Wake up! Wake up! Now which cheese you think you may eat all the while? Gallo cheese with the blue rooster on the label is the traditional and the real deal. The original Dutch, redback or hard cheese in Belize. Be aware, check your label and make sure it is in English and for the Belize market. Gallo cheese with the blue rooster, the real deal. Santiago Castillo Limited, supporting and building our Belizean community for 95 years and counting.
Gallo Edam Dutch cheese, aged and tropicalized, the best formula for the Belize market, exclusively distributed by Santiago Castillo Limited.
Last month, my father passed away due to COVID-19. My father was not vaccinated. He was not. To be truthful, the things he would have said would be the things that we're hearing around town. But there were also some of the other things, some of the other myths that really I was trying to tell him, no, Daddy, you need to get your vaccine. But I couldn't convince him in time.
I think what they're doing is a disservice to this country. In my mind, what they're doing is creating fear among people when they should be spreading a message of hope. What I hear them say has no basis, no scientific basis for the assertions they're making. And more than anything else, there's no legal basis for their assertion.
Would he have gotten that vaccine, he would still be here cracking his jokes and being his fun, crazy self, and we really miss him.
And welcome back. We're moving into our final segment, and staying with me now, I have Dr. Cuellar, and I also have Deshane, who will be answering questions. We encourage you to send them in by video if you are bold enough. We really appreciate it. And we're jumping into our first question, and we're going to try and make our responses as quick as possible. Question here: why aren't the Belizean people being tested first for positive or negative results of COVID-19 before getting their first shot? What if I'm infected and don't know and I get my shot? Why aren't questions asked if you have been infected before and how long before putting your first shot? When will the government buy other vaccines?
Yeah. Well, I can answer most of them. I can't answer the last one when I don't speak on behalf of the government, of course. The other one is a really good question about getting, and that has been debated. I actually have had clients and patients that have had the vaccines while it's been infected and not knowing it. So that's a good thing. I think it goes down to cost, getting a shot than the vaccine, but I think that's a good consideration. But I do know that when you get vaccinated, you do get a questionnaire that you fill out. And I always hear that it's always well asked and thoroughly asked. So trying to answer quickly, no? But that part about being tested and getting a vaccine does have some sense to it, no?
But you as an individual, perhaps if that's a major concern, you could go and get tested before, right? As a,
but I have had, actually I've had a gentleman just this week that I actually was misled a bit because he had been vaccinated 3-4 days before he came to the hospital. And I thought his symptoms were more vaccine-related, only to find out 24 hours that it was indeed a COVID infection. So that speaks to what he spoke about just now.
And
good point.
What happens then?
Well, we treat as a COVID patient.
Okay. Now, let's move to our next question. Since I already caught COVID-19, why do I need to get vaccinated? Because my body has already dealt with the virus.
Yeah, another good question. The study so far has shown that the virus will have your body create these antibodies, and they're looking at 6 months before your antibodies numbers actually go down. That becomes unsafe again. So that's why you would say 6 months after actually getting the infection, you would require a vaccine. And that also speaks to what you're hearing about now, boosters, no? There's a big debate right now whether or not we will, which more than likely we will, be requiring boosters every year enough to keep our antibody levels up.
All right. Let's move to our next question. Question number 3. Can the doctor explain the mechanism of action of the vaccine?
Right now we have, we have, but there are 2 big platforms of vaccines. We have the mRNA, which is our technology that uses the genetic material of the virus, and we have the other one called vector viruses, where they take a piece of it, put it in a known virus to man, the adenovirus, which is a flu virus. And what these particles of the virus does, it stimulates your immune system to make these antibodies, so that when the real virus comes, when you're coming face to face with the real virus, you already have a memory, and you say, you know what, I'm already prepared to face you, and I can deal with you easier, so to speak.
All right. Let's move on to our next question. It goes as follows. Dr. Cuellar, is the AstraZeneca vaccine safe for a lactating mom?
Excellent questions, guys. If you had asked me this question some months ago, I probably would have said none. The information has changed that it is safe to use during breastfeeding.
All right. Next question. Good night, Dr. Kuyar. Can a 50-year-old person with fits take the vaccine?
Yeah. Generally, the general answer to that is yes. But I always encourage people who have pre-existing condition, medical conditions, should have a sit down with their doctors, with their caregivers, to discuss their own particular situation. That's always my best advice. Go to your doctor, say, you know what, I got this, I got that, I got Tara, am I a candidate to take the vaccine or not?
All right. Next question, please. After contracting COVID, does your personality change? Do you become more sensitive to your emotions? I think that will be for you, Deshane.
Not
that I'm aware of. If you notice a personality change, then it could be a trauma response, right? So if you feel that you're experiencing a personality change, or someone that you know is changing in their behavior, then I would recommend that they see a mental health professional to go through that process.
So, but let's say just crying more, or because I think they're talking about the emotional response.
Sensitive.
More sensitive, perhaps?
Well, that question is too vague for me to be able to give an answer.
Okay.
But I haven't read any research that talks about that.
All right. The next question, please. When will the other vaccines become available here? The ones that are 95% with no side effects. The AstraZeneca is the least effective one and has the most side effects.
That last part of the question, that question isn't that, or that statement isn't true. It's not the least effective or the most side effect. Again, I can't answer for the country, for the government, and when we've already had the Chinese vaccine. Already knowledgeable that we'll have soon.
And didn't we get the Sputnik? Or
we had some Sputnik indeed, and we're about to get some Pfizer vaccines. No? But AstraZeneca has hold its own worldwide.
Yeah. Next question, please. How do I convince my elderly mom to take the vaccine?
Listen to your mom. Listen to what her real concern is. It's always more than just taking the vaccine. It's understanding her hesitation will give you that answer. So the best thing is to listen. What really is the concern? So for example, earlier nurse was talking about why she took a long while to take the vaccine. She had to consider her job, how many days off, and if she would get a paid day off. So we have to be able to listen to what really is the concern to be able to give them appropriate answer.
All right. Thank you very much, Shane. Francisco Flores asks, how can you prove it's COVID? Give me a breakdown of the it. Could be maybe pneumonia.
Okay. Pneumonia is generally an infection of your lung. You can have pneumonia from bacteria, which is even more common. And we have pneumonia from this coronavirus. We have pneumonia from other types of viruses also. But this one in particular, you can listen, examine your patient, can listen to the typical songs a lung makes when you have pneumonia. You can do a chest x-ray. You need to do your PCR to make sure that it's present in your body. And I think one of the most characteristic signs of pneumonia is what we see with a CAT scan. It's very peculiar with this COVID-19. So there's a lot of ways to say this is a pneumonia caused by the COVID-19 virus.
All right, and with that, we've come to the end of this segment. We do have one more question. Can a woman over 80 who had thrombosis get the vaccine?
Yeah, thrombosis is a fancy word for blood clot. And like I say, you always ask your caregiver if it's recent, because if you had a blood clot within the past year, you're definitely not a candidate. But if you had it 20 years ago, that's nothing here or there, no? But again, going back to that same point I made, you go talk to your doctor.
All right. We have one final question, and it goes, can a variant develop in Belize of the Delta variant or the COVID-19?
Yes, it can. We hope not, but it can. It can develop any part of the world. No? But
it doesn't go by numbers, because I was going to ask earlier.
The more number you have, the more chances. But I don't know. Maybe the sea breeze that I believe might make them decide for change. So it's possible, unlikely, but possible.
All right. And with that, we're going to go ahead and take our final break. And when we come back, it's just for a wrap. Get the Facts wraps up after these messages.
We do our best in the media to get the information shared on vaccines with you, so you can make that decision. We aim to be accurate and timely, and will continue to do so for the development of our people and this country. I will take the vaccine when it's my turn. I urge you to take it too. Hashtag #GetVaccinated_Belize.
It is my time
to protect your life.
Don't wait to vaccinate.
I believe in the COVID-19 vaccine.
Do not hesitate, Belize. Vaccinate. Be COVID-19 safe.
The vaccine is the best way to protect lives.
Don't wait. Vaccinate.
If you care, love them,
Protect them.
vaccinate them.
Travelers is proud to do its part to protect you and your family by bringing to you Sanibel, a World Health Organization formula that kills viruses on contact faster than gels. It could be used as a hand sanitizer spray as well as a disinfectant for surfaces at home and places of work. Travelers, always there.
We approach the fight against COVID-19 in the way we approach many other challenges, by looking for ways to achieve joint solutions and staying resolved to help our people. I know how anxious we are to see life returning to some normalcy. The COVID-19 vaccine offers our country a reason to hope. We are in this together. I will be safe when we are all safe. I believe in the COVID-19 vaccine. I have taken the COVID-19 vaccine, and I urge you to take it too. Hashtag #GetVaccinated_Belize.
It is my time
to protect your life.
Don't wait to vaccinate.
I believe in the COVID-19 vaccine.
The vaccine is the best way to protect lives.
Don't wait, vaccinate.
Don't hesitate, Belize.
Vaccinate. Be COVID-19 safe.
If you care,
love them.
Protect them.
Vaccinate them.
And welcome back. We're getting ready to wrap our show, and so we'd like to give our guests an opportunity to have a parting shot. Shane?
What I would like to tell people is it's okay if you're not sure. It's always good to reach out, and it's important that you ask the questions. You know, we understand that there are so many factors that you need to be able to make a decision for yourself and what's best for you and what's best for your family. But also know that if it's causing you anxiety, that you could reach out to a mental health professional so that you could process this. It's not an easy choice, and we understand that. So I encourage you, if you're having anxiety about deciding whether or not to take this vaccine, reach out to a mental health professional to process those questions that you have.
All right, thank you very much. Dr. Cuellar?
Well, I definitely want to second what my colleague has said, very, very good words. And I would want to tell people that those of us in healthcare, we don't only look at the actual sickness, but not only the lives saved, lives lost, but also the livelihood of people. And that's a big thing in Belize, you know, that the livelihood has been affected so much, economy causing anxiety and stress. So we have to have that balance. Now we just can't say, well, we're going to do this and not be worried about the livelihood, the economic implication of the pandemic. We have to, as physicians, as healthcare people, also take that into consideration and make wise and hopefully sound advices. No? And again, if you have any, you have a right, you should, you have an obligation to have these questions being asked and answered properly, okay? But get your information from reputable sources, no?
All right. And with that, we've come to the end of Get the Facts. Please feel free to join us next week. And we encourage you to be interactive by sending in your questions either through Facebook or through a personal video. Thank you. I'm your host, William Neal, and I want to remind you to wear your mask, wash your hands, watch your distance, and of course, get facts. Good night, everybody.